Yeah, we've started now. Thanks, Emery.
Thanks, Gillian. So recording is now started. Good evening and welcome everybody. Thank you for joining us today for our webinar on barriers to involvement in PPNs. We're really pleased to have you all with us. By way of background, one of the key recommendations from the PPN Structural Review report that was published in 2022 was to minimise the barriers to participation that experienced to achieve greater partnership in participation. The department, working with the PPN community, commissioned a research project to explore the diversity of groups that were involved in PPNs, investigate whether there are underrepresented groups, and to make recommendations on increasing the participation of any such underrepresented groups in PPNs. S3 Solutions were commissioned to carry out the research, and as you may already know, their final report, along with a reader-friendly version, was recently published on the PPN landing page and circulated to all PPNs. I'm now pleased to welcome Eamon Sadak, Consultancy Director at S3 Solutions, to present on the report findings, and we are looking forward to hearing his report insights. And so, without further ado, I'll now pass you on to Eamon. Thank you all very much.
Thanks a million, Emery, and if you just bear with me while I bring up some slides. Hopefully they're just appearing on your screen now as we're talking. Can everybody see that okay? Perfect, thanks, and good evening everybody, and thanks for joining us and giving up your time this evening. I'm really pleased to have the opportunity to share the findings of the really important piece of research looking at the barriers to involvement in PPNs. And I suppose the work commissioned by the department and carried out by our team over the course of 2024-2025 is something we were really keen to bid for at the outset. We've seen this as an opportunity to deliver something that could have a tangible impact and a practical use case for a really important network in the PPNs, and we understand the important role that they play in supporting decision making. For those that don't know the company, we are a social change consultancy company that help organisations access, manage and measure the impact of public funds. So this piece of work was something that really aligned with our core work and our core values and ethos, and we look forward to sharing the findings. Just to start very briefly, I suppose I would like to recap maybe on the objectives that framed the study, and there were four main aims that framed the piece of work. The first was about collecting and analysing data on the demographic characteristics of the groups who currently take an active part in PPNs and in PPN activities. Then using that information was to identify any population groups that may have low or no representation. And for those that are identified with low or no representation, to then engage with them directly and to hear in their own words, I suppose, what barriers they experience and what might make engagement in PPNs more appealing or more accessible. And then finally, to take all of that information and develop a set of recommendations that would be both practical and implementable, and as well as strategic, that could address the barriers identified, and specifically within that to contribute to the development of a youth engagement strategy for PPNs, which was something that was previously identified as important. So when we were appointed, I suppose we tendered for the work, and we set out a methodology that we believed would meet those objectives. We designed a kind of structured four-step methodology that contained both quantitative and qualitative approaches. And at the outset, that comprised of a desk review, which was about analysing secondary data that existed, such as the PPN Salesforce system, annual reports, kind of strategy documents, and previous reviews like the structural review that was carried out a number of years ago. The main body of work for this research, and the most important element, was its consultation phase, and that was divided up into two key phases. The first phase was with existing PPN members, and that really allowed us to map perceived diversity within the existing networks and to identify from the perspective of existing members any gaps in representation and hear firsthand from those members about what they maybe perceive as the barriers and challenges that prevent people from engaging in PPNs. And phase one was really important in then shaping and informing the subsequent phase, which was focused on groups that were underrepresented or not represented at all. And this included targeted engagement with organisations working with young people, people with disabilities, ethnic minorities, LGBTQI plus communities, and ex-offenders were identified as one of the target groups as well. And then step four was about taking all of that information in the round, analysing it, But importantly, once we developed some emerging findings, to go back and test that again with the groups that had contributed to the research to make sure that the findings resonated with them, reflected the views that they contributed to the research, and that the recommendations were actually ones that could make a difference and be impactful. So across the process, over 300 organisations contributed to the research through the surveys, the interviews and the workshops. And I suppose the breadth of engagement gave us a really good understanding of the system from a range of different perspectives. When we looked at the overall participation in both phase 1 and phase 2, I suppose we kind of identified 3 key categories of contributors. The 288 groups that have direct experience of PPNs, either as current or former members, contributed, and they provided deep insights into the kind of workings of PPNs themselves. 13 organisations who were broadly aware of PPNs but maybe didn't fully understand them. They may even have registered in order to access funding, contributed, and then 5 of the organisations had no prior awareness or understanding of PPNs. And I think that mix of perspectives was important, so we can explore perspectives from those that had direct experience of PPNs and maybe those that were on the periphery as well. So in terms of that first phase 1 consultation, which was really about identifying underrepresentation within PPNs, to do this, firstly, we reviewed the PPN membership using the National Salesforce database. Now that proved challenging, to be honest. We know that the membership is broken down by its different kind of colleges, but it was difficult to distinguish between groups that were maybe active or passive, making it difficult to kind of draw conclusions about representation, and that's a theme that would subsequently emerge during the consultation process. We then issued a survey to existing members, and that also identified difficulties for existing members to identify representation, and we had examples of some members from within the same PPN who maybe had different perspectives on representation from some target groups, which highlighted again maybe the issue around whether participation or membership was passive or active, and some uncertainty around that. But based on the feedback that we did receive, we were able to identify 5 key groups that were perceived to be currently underrepresented, and as referenced, those groups were people with disabilities, young people, LGBTQIA+, and ethnic minorities, including Irish travellers, and ex-offenders. And those groups were agreed as the groups to be prioritised in the phase 2 consultation. So that finding probably echoes earlier reviews, but I suppose it didn't just explore underrepresentation in of itself. The fact that we were surveying existing members meant we had an opportunity to ask those members what they perceive to be the potential barriers that are stopping some of those groups from participating. And a number of key themes emerged from those conversations with existing PPN members. The first one relating to dominance of meetings by individuals and colleges, and that was referenced consistently during that phase 1 consultation, perceiving to create an imbalance where some voices are amplified over others, and particular reference was made in that context to the environmental college and the strength of voice that they may bring to PPN meetings. Accessibility was referenced consistently again, specifically around the language and presentation of information and the communication materials that are used, as well as accessibility of venues and digital accessibility within PPNs were noted as issues. There was quite a strong reference to complexity in terms of the PPN structures, and they're seen maybe as hard to follow by some representative organisations, and for new members that can be potentially daunting, with unclear lines of influence and decision making. A really strong theme that emerged, and this will continue through the phase 2, was around the value, and whilst getting access to information and access to funding were identified as the main motivators for somebody or for an organisation joining a PPN, there was strong reference to when members didn't see tangible outcomes or impact, that sense of value kind of dropped off quickly. And then finally, the kind of confidence. So the need for that kind of human interaction and encouragement, particularly for low capacity or volunteer-led groups who maybe didn't feel welcome because of prior experience in structures and networks, or didn't believe that their input would make a difference. That kind of outreach and encouragement was really important in trying to stimulate engagement. And again, we have some really positive examples of how that worked. But though that feedback from phase 1, I suppose, was compiled and then used to construct a question frame and some pointers for our consultation then in phase 2, which involved both a further online survey as well as direct interviews with representative organisations. So phase 2 took us deeper into those issues, and as I say, we were able to develop a question frame based on the emerging insights from phase 1, but it really focused then on understanding the experiences of those groups directly. So 26 semi-structured interviews were carried out. A further online survey was sent out. We received 50 responses. And then after we had done an initial analysis, we went back out to those groups that participated in the interviews and facilitated 5 co-design discussions with those stakeholders in order to substantiate, challenge, validate, or amend some of our findings. All the interviews were recorded. We carried out a thematic and narrative analysis, and we continued to collect information until we felt that we weren't hearing anything new from the meetings or the survey findings. We felt we reached that point of saturation, and that we had collected all of the themes that were going to emerge through the process. So the main themes that emerged, they're kind of categorized under 3. The first one, and came through really strongly, was around that perception of value of PPNs. That looked at both the impact that PPNs have in terms of decision making, the complexity of their structures and how that lends itself to value, the importance and value of outreach and sort of stimulate engagement. There's reference to negative experiences and mandatory membership. Accessibility was another huge feature, and that cut across accessibility of venues, information, of meetings, and practical barriers that people may face in actually attending and contributing to PPNs. Thirdly, we heard a lot about time and resource challenges, and whilst they were really important for the target groups, those were challenges that people identified as maybe applying to all of the organisations that might want to be involved in PPNs, but it was felt they were compounded further by those target groups that were experiencing other barriers. And we'll explore each of those in a wee bit more detail. So the first one that came up was around the value of PPNs, and I think the recurring question that we heard was around what difference does my participation actually make. There were, I suppose, perceptions of tokenism in terms of the contribution of some members within PPNs, and those that we consulted continuously pointed to a lack of concrete results, and not necessarily that those concrete results don't exist, but maybe they're not communicated in a way that's accessible or that's easy for people to understand. And there were the constant reference to, if we don't understand how a PPN makes a difference, how an issue that is raised can navigate its way through all of the different structures in the PPN to a point that it's created a change, it's influenced a decision or a policy, and then how can we buy into the value that it can potentially create? It's worth, I suppose, referencing at this stage that there were references, particularly during the phase 1 consultation, about the tokenism that was perceived to be found for PPNs in decision-making structures, and that in itself is having maybe a potentially knock-on impact in terms of a barrier to participation, where those that don't see the value in participating because of a perceived tokenism that occurs right at the very end, in terms of local authority committees and structures as well, although the focus of this research was very specific on the PPN activity itself. The complexity of structure was referenced quite a lot, and groups, I suppose, referenced the challenge in understanding how a PPN operates in practice. What does my participation as a group actually look like? They felt that structures could be quite drawn out, and participation could feel complex. And I suppose a quote that came through and we used consistently was that notion that if participation feels like it's complex, and you can't understand how your participation leads to a change, then how would you expect someone to be motivated to engage with that structure? And I think that really captures nicely some of the challenges that came through around that perception of value within PPNs. Many of the respondents referenced negative experience of PPNs, again, as with phase 1, reference to the domination of PPN meetings by individuals or colleges, and again, strong reference there to the domination of meetings by environmental colleges. There was a strong and consistent reference within the meetings we had about the environmental colleges have a more difficult, I suppose, criteria in order to be accepted. There was a perception that those types of organisations tend to be dominated by people that may have strong capacity, strong education, and therefore are more able to navigate the complex structures that exist and navigate the complex information that's shared, and therefore the structure nearly lends itself to domination by that type of organisation, and that's a theme that came through strongly in the meetings that we had. Close to that was the lack of representation, and I suppose a lot of the groups would have referenced that when they can see somebody else from their target group, from their community, represented in decision-making structures, that it motivates and inspires others to get involved, and that the lack of representation may therefore be having a negative impact in terms of participation. And there were examples referenced of feeling discriminated against, that participation was tokenistic and maybe excluded, and referenced those experiences outside of PPNs, but also within PPNs as well. A really important kind of theme throughout the consultation was this, the concept of mandatory membership of PPNs in order to access funding. And I know that doesn't apply to all, but a lot of the consultees referenced that forced membership or perceived forced membership to access funding is contradictory and counterintuitive to the voluntary nature of PPNs. And whilst there's an understanding as to the benefit of why membership would be beneficial from a funding perspective, because it demonstrates that an organisation is registered, is organised, and is therefore capable of receiving funding, and there was a strong view that you should not be required to be a member of a PPN in order to access funding. And as a result, there was a strong view that the 20,000 PPN members referenced in the national database is therefore a misleading figure, and it promotes a false sense of inclusivity and participation, which in many ways then deepens a sense of mistrust and distrust in the figures that are there and the experience of PPNs. And that concept of mandatory membership was something that groups felt very strongly about during the consultation. In terms of accessibility, again, another key challenge, and there's a number of different dimensions to that. It takes many different forms. First one being around accessibility of venues, and this came up a lot in terms of making sure that there's appropriate geographic spread, that there's appropriate compliance in terms of people with disabilities. For the LGBTQI+ community, the provision of gender-neutral facilities was seen as important, and as well as that combined in-person and online approach to support accessibility for as many members as possible. Geographic spread was particularly important for areas that are difficult to reach by public transport and that have maybe more rural counties, and that came up strongly in those. In terms of the accessibility of information, this was raised a lot, and a strong view that things should be simplified across the board, that the use of jargon and the volume of information received is intense, and word-heavy documents like the statements of well-being, some were referenced as being 50 and 60 pages in content, and whilst some of the content was identified as being really good, it's a lot to take in for some of the organisations, and they felt it made it inaccessible, and again lends itself to those that have greater capacity to take in and digest that type of information and process it through a PPN structure. And all of that combines, I suppose, to make it less appealing, particularly for young people, but for those other target groups that were referenced during the consultation and identified as underrepresented. So a simplification of language and materials was required. In terms of the specific PPN meetings then as well, we heard that both the format of meetings and tools used were referenced as a barrier. Lots of reference to meetings becoming academic in nature and not as facilitative and interactive as they could be. a lack of opportunity for young people, for example, to have support with them, a youth worker to attend with them to ensure that they can contribute, missing things like dedicated or limited speaking time to avoid dominance of meetings. And there was strong reference, particularly from people with disabilities, around some of the assistive technologies as not being suitable in terms of being able to access the information that's actually being shared within meetings. So some really practical barriers to allowing full participation within meetings. And then again, when we think about practical barriers, some of the consultations talked a lot about the accessibility stuff, but then came back to some of the more simplistic things around none of that matters unless you can actually get to meetings in the first place. And there was a strong reference to the associated cost of getting to meetings where it's appropriate. And obviously time and other commitments that we referenced earlier apply across the board, but it feels like that's compounded by unclear value. So if someone's already time poor and struggling because of family or work commitments or something else, then where they can't see any additional value in something, they're not going to allocate the limited time that they have to taking part in that. The very nature of this research and its title is about barriers. So a lot of the stuff comes up, references things that are challenging, things that are difficult, things that aren't working, and therefore it feels at times like that can have a negative tone to it. I want to try and balance that by referencing the proactive encouragement and outreach. So a lot of the groups reference that whenever a resource worker, someone engages with a group, goes out and meets them, explains things, shares how to get involved, and breaks it down, that is a really effective way of engaging underrepresented or low represented groups. And there were numerous examples of that happening, of absolutely brilliant work by resource workers to try and reach out and ensure that the PPN is as inclusive as possible. Interestingly, in the context of this research, a lot of the groups that we spoke to would have associated some of that proactive and positive work with PPNs that were perceived to be independent. Now we know that all of the resource workers, even if they're housed in a local authority, operate in an independent way from the local authority, and actually a lot of the positive examples that we received and were referenced were from resource workers that are located within local authorities as well. So again, there was an issue there around maybe fully understanding PPNs and their structure and mechanism, but I think it's worthwhile noting that there's a lot of really good work that goes on. There's a lot of positive examples, a lot of effort to try and make PPNs inclusive and accessible, and that outreach is a really effective way to do that. So all of that information, I suppose, together led to the development of a series of recommendations around what needs to happen next. And the recommendations that we've developed, I suppose, are designed to be practical, to try and align as close as possible to the evidence that came through in this consultation, and try and align to any national policy frameworks and strategies that are out there. As we developed these recommendations, and we did develop an initial set, we did facilitate those 5 co-design meetings, one for each of the key target groups, and we sense checked the recommendations. So we shared our findings, we shared what we heard, we asked, did it resonate, did people connect with those findings, was there anything missing? And we were challenged on the recommendations. We were challenged on whether or not they were achievable enough, whether they were practical enough, and that led to some amendments and adjustments. And we feel that was a really valuable process in making sure that those that were most affected actually could help shape the recommendations. So the first one was about developing, I suppose it's about communication and transparency, and we were suggesting that the development of really clear, practical, jargon-free guides, particularly including videos and digital content, that clearly set out how a group can engage and succeed in PPNs is a key recommendation. And the goal here is to make sure that the PPN system is visible and understandable, so members can see how their voice can actually make a difference within the PPN. The second one then, and based on what I've just said about the targeted outreach and engagement, is to invest in that, and particularly in things like youth strategies in partnership with national and local organisations, but importantly that there would be ring-fence funding designed to support those, and that would involve working with groups like youth organisations, disability networks, traveller and migrant support groups, and LGBTQI+ organisations, and it should link directly into a youth engagement strategy, so that young people in particular are supported to participate. A third recommendation is around an accessibility overhaul, And we know that lots of PPNs are already trying to do a lot of good stuff in this space, and there's lots of learning that can be derived from existing good practice. So sharing that amongst PPNs is something that would be beneficial. But this means improving access to venues, making sure communications in sort of plain language, producing easy read and multilingual materials where appropriate, and building cultural competence amongst facilitators, coordinators, amongst secretariats and other structures within the PPN, so that underrepresented groups can be included, as well as ensuring that there's dedicated representation for some of the target groups so that others can see them being represented and participating fully in PPN meetings and activities. The fourth recommendation was about a participation budget, and this would provide resources for transport, for interpreters, and for support staff like youth workers to come and assist young people to participate fully in PPN meetings, to ensure that there's the right assistive technology within meetings so that we can remove practical barriers to participation and that groups can participate fully within meetings. The fifth then comes back to that challenge around membership. So we did reference that there was a difficulty in understanding representation because of confusion around active and passive membership and uncertainty around that, as well as the requirement to be a member of a PPN to access funding, which groups felt really strongly that was counterintuitive to the very purpose of PPN. So the recommendation here is about revisiting and redefining how membership is defined and measured, using something around the active versus passive membership, that mandatory PPN membership for funding should not be common practice, that should end, and that a new set of KPIs should be developed. And I know there's a draft set provided in the report that hopefully stimulates the conversation and starts the conversation, and that they can be adopted that actually measure meaningful participation and measure the things that will determine whether or not a PPN is inclusive, where groups are engaging, and whether it's making a difference and having an impact. And finally, ex-offenders were one of the groups identified as underrepresented. We did try and reach out to organisations that work with ex-offenders. We didn't get great buy-in and participation in this research process, but there's probably a need for targeted research and engagement with that group, and they understand barriers and support participation there, and that's a potential follow-up piece of work that could happen. So that's the key recommendations that came forward, and hopefully a good summary of the report itself. I suppose at this stage I want to finish by thanking the department and the team here who for commissioning the work, for putting their faith in us to carry out the work. They pushed us all the way to make sure that we reached out as much as possible, and as many groups as possible could participate in the process. They challenged some of the insights and recommendations coming forward, and they held us accountable throughout, and we really appreciate their insight, their expertise and their time. I want to really thank all of the PPN members, the coordinators, the community organisations, the resource workers who gave their time, who give their expertise, their stories, their insights, for their honesty and openness in the process. It's been invaluable and really helped shape and inform the report. And finally, thank you to you all this evening for listening, and I hope you found that valuable, and I'm happy to now take any questions or reflections.
Thanks very much, Eamon, for your very kind comments and for your insightful and informative presentation.